Welcome. This is the audio component of the book Pharmacology, Drug Names Decoded. I'm going to be narrating the pronunciation of a number of the drug names, and I am Tony Guerra, Pharm.D. Inside the book, you'll find the chapter introductions, which is a summary of one of the 8 physiologic states. You'll find mnemonics, written pronunciations, and you'll also find practice review exercises. In this series of videos, I'm going to pronounce the drugs, showing only the generic name on the slide, but I'll say the brand name because in your practice, all you're probably going to see is the generic name. My students also, in their final exam, are going to have a cumulative portion, and that portion only has generics. The video series is meant to give the repetition that students need to not only hear the drugs, but to recognize, oh yeah, I remember hearing that in the GI section, oh I remember hearing that in the cardiology section. I have triplet 1-year-olds. I'm really busy, and I know they're really busy, and hopefully having this on YouTube allows them to hear it over and over again and get that repetition in those in-between times, maybe in a commute, maybe when they're working out or something like that. So let's get started. These are gastrointestinal drugs, and again, this is just representational. I've only got 11 drugs I want to go through. The book has all of the pronunciations there, but I want to make sure that those 144 drugs I'll be testing, that you've heard these at least one time. There's 7 actual classes of drugs that I'll be presenting. Antacids, which are just what they sound like. They're an anti-acid against acid. H2 blockers. These are antihistamines, but not antihistamines for allergy like most people are used to. That's an H1 blocker. But our vernacular, the way that we talk, is to say antihistamine means something for allergies. An H2 blocker is something for acid. Proton pump inhibitors. A proton we're talking about is a hydrogen proton, H+, and this is integral or very important for acid. If we're going to block the pumps that create those protons, then we can reduce acid. Anti-nausea is just what it sounds like, or anti-emetics. Emesis is vomiting or throwing up. A stool softener is just what it sounds like. Antidiarrheals, going the other way. And ulcerative colitis. So ulcer is what this inflammation of the colon causes, and ulcerative is the adjectival form, and then colitis is the inflammation of the colon itself, so ulcerative colitis. The first drug, an antacid, is calcium carbonate. Brand name could be Tums. So that's calcium carbonate, which is an antacid. Magnesium hydroxide, another antacid. Brand name of that could be milk of magnesia. That's magnesium hydroxide. Famotidine is Pepsid. That's famotidine. And we see that famotidine has tidine as the suffix. And this suffix generally is going to tell us that we have an H2 blocker. The same is true for cimetidine, cimetidine. That's tidine is going to give it away, and that's Tagamet. Ranitidine is Zantac, ranitidine. Omeprazole is the next drug, and that's representational of the proton pump inhibitors. The proton pump inhibitors have Prazole as the suffix. You want to be careful though, because there's one specific drug, aripiprazole, which is an antipsychotic that has the prazole ending, and also azole as an ending is sometimes used for antifungals. But if you have prazole, Prazole, usually that's going to be something that's a proton pump inhibitor. The next drug is lansoprazole, Lansoprazole, and again that prazole is indicative of a proton pump inhibitor. The brand name for that would be Prevacid. Ondansetron is Zofran, ondansetron, and that's an antiemetic or anti-nausea drug. Docusate sodium, which is Colace, docusate sodium, that is a stool softener. Loperamide is Imodium, loperamide, that's an antidiarrheal. And the last drug, mesalamine, that's Asacol, which is a drug for ulcerative colitis.